Iatrogenesis just is a Greek word. It just means when a healer introduces harm. And we know that any intervention, by definition, any intervention from Tylenol to x-rays, that has the power to do good, has the power to heal, also by definition has the power to harm, right? You don't want to get exposed to too much radiation. So if you don't need an x-ray, don't get one. And you don't want to be exposed to the infections in an emergency room. So if you don't need to go to hospital, don't go. And the same is true of psychotherapy. I never deny that it is a powerful intervention. I believe that it both is powerful and that it can be really helpful and even, essential for people. But then we have to acknowledge that it can also introduce harm, and it does in a significant number of patients. And the point of the book, of course, is not to suggest that no one should ever get therapy or even that no child should, but just that it does introduce risks. And I believe that's what we're seeing in the rising generation. So you have a lot of people dabbling in therapy with children. So not even just the parents who are affluent enough to take their kids to therapy, but even ones who show up for school, or parents who read the therapist written parenting books and are trying out a kind of therapy in place of discipline with their children. So these kids are absolutely inundated with psychopathology. They are understanding themselves with the language of psychopathology. You never hear an American teenager or kid anymore say that they're worried. They're always anxious. It's always my anxiety. They never say sad. They're always depressed. They never say that, they went through a hard time. They say they have PTSD. So they're really understanding themselves in the language of psychopathology. So if you believe you need therapy, some people objectively need an intervention, but if you believe you would be helped by therapy and you sign up for therapy and there are things you want to work on, I'm all in favor of that, right? First of all, but what I wanted people to know with the book is it's an entirely different situation putting a child in therapy. And the reason is, if a therapy isn't working for a child, if a child is not in a position to say things like, I think we're putting a little too much blame on my mom, or I wouldn't call my parents toxic, that doesn't seem right, or I don't think that qualifies as emotional abuse, my dad just wasn't thinking when he said that, or something. Those aren't things a child is normally going to say. So and there's no oversight, right? Nobody is measuring, oh, is the child's anxiety now worse? Is their depression worse? And here's what I'm most concerned about. Is their sense of inefficacy worse? We have a generation that has an external locus of control, meaning they don't believe they can make a positive difference in their own lives more than we've ever seen before. These kids feel incapacitated, and the habit of reporting everything to an adult, an expert, that is exactly what you would expect to see. Kids who feel like they can't manage just mundane conflicts of teenagehood on their own. And what I want people to know is it's not just the kids in therapy who are getting this, right? It really has leached into the cultural bloodstream. Everyone believes that sitting around rehashing your pain is the way to get over it. And of course, the research shows the reverse. Rumination or endlessly dwelling on a past pain is a classic symptom of depression. We are inducing kids into habits of depressed and unwell people. So unsurprisingly, they don't think of themselves as well.